Good morning, I'm Joan Angeles from BSN 2A, a second-year nursing student from Metropolitan Medical Center. And for today's activity, I will be doing the perineal care. So what is perineal care? Perineal care involves washing external genitalia and its surrounding with soap and water or with irrigating solution. So it is done for cleanliness and comfort of the patient, to prevent infection, to promote healing of perineal wound, and of course, for preparation for a treatment or examination. So in this procedure, we will be needing bedpan, bed screen, perineal tray with forceps, cotton balls, dry and wet, soaked with soap or solution, waste receptacle, and perineal pad. Prior to the conduct of the procedure, I will review client's previous medical record if available. This is done to avoid instances of harm to the patient, to know their medical histories and their current treatment procedure. Before going to the patient, I will perform proper hand washing to prevent contamination and start preparing the equipment that I will be using. Upon entering the door, I will start assessing the client's general appearance and level of consciousness. So, good morning, ma'am. I am Joan, your nurse for today. Can you please tell me your name? Your birthday? Okay, ma'am. Can I check your wristband? Okay. So, good morning, ma'am Ann Santos. What do you want me to call you? So, today, Ann, I will be doing the perineal care. So, this is to clean your genital area. So, to prevent or to eliminate infection, odor, and to promote healing. So, this is also for me to check any redness, infection that may be present. So, all the results will be documented, but it will be kept confidentially. So, in this procedure, I might touch you. Is that okay with you? Okay, that's good. Thank you. So, if the patient agrees, continue the procedure. So, I will then provide patient's privacy by closing the door or closing the curtain for the patient to be more comfortable. Next, gather all the articles needed and place within reach. So it is important that all the equipments are all organized to be able to execute all the procedures smoothly and avoid the chances of error. Next is assist for your client's proper position and validate figures. Sure that you perform proper hand washing to prevent contamination. So ma'am, I will be putting bed pad to prevent your bed from getting wet. Is that okay? Thank you. Can you please turn to your other side? Do you want me to help you? Now to your other side, please. The client for dorsal recumbent with knee flexed and separated. So, ma'am, can you flex your knees? Okay, thank you. So after covering the legs and body with the top sheet, drape the legs by tucking the bottom corners of the bath blanket under the insides of the legs. Then bring the middle portion of the base of the blanket up over the pubic area. First, let's inspect the perineum and flush the perineal area with warm water. Note for any particular inflammation, swelling, and excessive discharge. Get the cotton ball soaked in cleansing solution using a pica forceps to maintain the sterility. Start from the midline from the mons pubis down to the anus, then discard. Spread the labia to wash folds using figure of 7 between labia majora and labia minora. Do it for each sides. Remember to discard the cotton balls after every stroke to prevent contamination. Secretions that tend to collect around the labia minora facilitates bacterial growth. Lastly, wipe from the pubis to the rectum. Flush the perineum thoroughly with a sterile warm water and dry the perineum with the same stroke. Remember to discard the cotton balls after every stroke to prevent contamination. Drying the perineum is important because moisture supports the growth of microorganisms and of course for the patient's comfort. Raise the buttocks with one hand and remove bedpan. Then place sterile perineal pad. Cover the genitals. Ask the client to turn to the other side and roll the soiled bed pad. And then go to the other side and ask the patient to turn away from you for you to get the perineal pad. So discard and don't forget to do proper hand washing. So after the assessment, make sure that you perform proper hand washing to prevent contamination and make sure to validate your patient feeling about the procedure. And lastly, document all the findings in the client record.